so you'll be able to access that recording at another time. My name's Steve Matthews. I work with FaithX as one of the missional consultants. And today we have with me our co-hosts, which are me, Mary Francis, and Ken Howard. And so Mary and Ken can wave, but in the matrix, you may not see them right away, but you'll have the opportunity to hear from them a little bit later.
Welcome. So I said, oh.
And we also have special guests today from St. Luke's Church, La Iglesia de San Lucas in Long Beach, California, the Reverend Jane Gold and the Reverend Nancy Frausto, who are joining us today. So we're glad to have them, and we're going to hear from them a bit more later too. As you can see from the agenda, we do have a full hour. We're going to be having some time for presentation. There's going to be some time for question and answer along the way. But I also want to encourage you to use the chat. We find the chat really helpful. Sometimes people have very insightful things to offer that we may not get to in the Q&A. And so that's a really great place for us to be able to later go back and see what's been going on in the conversations. So we encourage you to do that, and we will be checking in with the chat periodically. Mary will be inviting comments from the chat. So we want to let you know that. So there'll be opportunities for you to share on multiple levels. And so our goal today is not so much a how-to about getting back in the building. I know that that's part of what we're all hungry for. But our goal today is to provide you with a process and tools that you're going to need. Tools that will help you assess the impacts and ongoing risks.
And you know what you can do for me is
just make sure we're miking our speakers, muting our speakers, please. So our goal is to assess the impacts and ongoing risk of COVID-19 on your congregation and the community in which you serve, and to develop plans to carry out your congregation's vision and mission for its members and its neighbors, while appropriately balancing the risks and rewards.
All right, so it's time for me to jump in. I'm Ken Howard. I want to do to start with a kind of a quick review of where we have been and where we are and where we're going in terms of COVID. So this is where we've been for the last several months. Starting in early March of this year, 99% of congregations are meeting every Sunday.
It's webinars. So basically, we're all.
That fell off really, really quickly in April until we had like 7%, 6%, 5% still open for worship. And then late in April, early May, it started to climb back up again, 42%, 55%, 70%, 73% in July, and then the second wave hit. And this is what's been happening ever since. It peaked at 73% open, and since then, it's actually been going back down. 27% is projected for the end of December. So how has attendance changed since February 2019? Well, it's interesting to know that 29% have been below 50% of the average. 34% have been below 50 to 70% of the average. 21% are 70 to 90% of the average. 11%, you see this going down, 11% are 90 to 100% of average, and 4% are higher than the average, or 100% or more of the average. So a little food for thought in this is, what do you think is different between the last two groups and the previous groups? And I'll tell you what it appears to us based on our research is that the people who are seeing declines in worship have been using their online worship as just a stopgap until they can get back in the building. The ones who tend to be holding their own and increasing tends to be the ones that are leading into online worship and designing their online worship to meet the needs that people have now and worrying about getting back in the building later. And of course, it's a challenge, of course, to measure attendance in online services like Zoom and YouTube and Facebook Live to be able to compare. It's sort of like we said yesterday when I was talking with our guests, that it's like comparing apples to watermelons, but we have to count. So what are some of the changes that have taken place? This is also very interesting. There's three main changes that people have made for the long term in response to COVID. 12% have delayed a capital project, 8% have deleted a ministry, and everything else is below 8%, like 1, 2, 3% have done little things. And then 73% have made no changes at all. They're trying to do it exactly as they were before. And changes to outreach programs, right? The research says that 34% are active now in a hybrid space where they're doing some in person and some online. 38% have ended their outreach and have no plan to resume. And 28% have said they anticipating restarting their outreach, but they don't know when. So just wanted to give you that little background to kind of put things in perspective. And now we're going to jump into our case story. And this is where Jane Gould and Nancy Fausto will come in because they are the rector and the associate at St. Luke's, La Iglesia de San Lucas in Long Beach, California, who will kind of be our experts on the ground. We'll be providing the data, bringing the data and the maps to the table, and they'll be giving us a reality check on that, telling us if we're on the nose, on the money, or whether we're way off. So here is one way you can look at the boundaries of St. Luke's in Long Beach. We often tend to think of things in terms of parish boundaries or actual formal boundaries, but we find that people don't care much about boundaries anymore. And the most realistic boundary for your membership is a 15-minute drive time. 70% of your members will come from within here. So this is where 70% of the members of St. Luke's would come from. The red area here is 5-minute drive time. And we find that that's generally the area where you're going to do the most ministry, the most outreach. It's the area where you have the most influence and the least competition. So you're most responsible for the people in that area. So here are their attendees locations. We actually took a CSV file of all their households and drug them onto the map. And here you can see where they are. And if you remember the drive time, the 15-minute drive time, it's pretty accurate. About 70% of them are within that boundary. And when we actually are doing this live with the congregation, you can actually click on these and see which household it is. I clicked on one, took a picture of it, and deleted the information about the household name. So the greatest part of what we're going to be talking about today is COVID impact and vulnerability assessment. And that really has 3 parts: assessing the impact, triaging the people and the neighborhood, and then prioritizing, because you can't do everything for everybody all the time, all at once. So this is what we call our coronavirus COVID-19 impact planning report. It has 2 pages. The first page is a population summary, and the next page is key indicators. But just looking at the top page, you can see that some of the at-risk populations jump off right off the bat, that you have households with disabilities, which are more at risk for COVID-19, and population 65 and up with no vehicle. That is also a at-risk population. And some vulnerability indicators here include people with no health coverage, health insurance coverage, what kind of health insurance people have, and who, what ages are the people who have the health insurance and who don't, and the households below the poverty level. And now we get to the second page with key indicators. So this will be the ones that you'll want to pick out from this are different for every congregation because different things will stand out for your area. So this shows you several of the indicators. We've got some things circled in. One is language, because if somebody, for example, speaks Spanish well, but English not well, they're at risk getting services within the health system. You also can see population by age. 65 and older are right here, and that's a sizable percentage of the population. Here are the people with no health coverage broken out by age and the actual number. And here's the senior population broken out by age, because each of those 10-minute bands are more and more at risk. And Nancy and Jane, what is your initial response to seeing the community description and the key indicators?
We're both being quiet. I mean, I think part of what's clear to us is, particularly within our Spanish language worshiping community, the impacts of lack of facility with English, poverty, lack of documentation, which often leads to lack of health insurance, are having a serious impact on our immediate faith community. And actually, if your photograph of our neighborhood had come down a few more levels this morning, you would have seen at least 15 tents attached to our buildings, of those who are unhoused, who have literally attached themselves to the fences of our property because the church is perceived as a safe space to be. So, in terms of our immediate neighborhood, the high-risk populations are among us and all around us. And it's decidedly, as we make choices about what we do and what we can't do, those factors influence us. So we have, since March, every week maintained showers, clothes, and food on Saturday mornings for the unhoused, serving 100 to 150 people a week. But we have not physically gathered for worship because we know that folks would come for whom it would not be safe to come. And so we have relied on both Zoom and Facebook Live, and we've relied on personal outreach through texts and phone calls and formation and fellowship programs. So I'm going to punt to Nancy now.
I was just going to say ditto to everything you said, but I will add the statistic, the numbers you give us here on language are just so true. One of the things that in this time of the pandemic that we've taken on as an additional ministry is delivering groceries for those who cannot leave their home. And the stories I keep hearing over and over is the lack of resources to seek medical help. And these are people that are not necessarily COVID positive, but that have many other issues that are not being seen by doctors, that are now developing into even more serious health issues. Because one, they don't have the language, they can't understand. A lot of the medical appointments are on the phone, and the doctors either don't speak Spanish or the clinics or wherever they're calling are not providing translators. So that is a big issue that is affecting our community.
So a question from the chat, wanting to know, were you doing this kind of outreach to the unhoused before COVID?
So we have for more than 30 years done showers, and it has incrementally grown both to serve more people and it's just logical. If you're going to give someone a shower, you better give them clothes because they really can't put back on the clothes they walked in wearing. And if you're gonna be having them hang out for a while because they have to wait to get their shower, it's a good thing to feed folks. And so we have lots of community partners, including 2 of the local Episcopal churches who help us out with food, and others who help us out with clothes donations. So that's a ministry that is ongoing, but has had substantial changes in that we now have a mask required rule. We just give out masks by the hundreds every week. It's like, here's a mask and here's one for your pocket. Take one, wear one, take one to go. We have had people make us cloth masks that we can give folks. We have a retired nurse who is in the 60 to 65 range, who does a health check of temperature and COVID symptoms at the gate before folks come in. Because the statistic about people closing down programs, most of the faith communities in our neighborhood that did feeding programs aren't doing them anymore. And so we are actually seeing, because Long Beach has been a part of Operation Door Key and has expanded shelter space, we're actually getting more people coming just for food and clothes because they may have a slightly higher access to showers if they're in a motel room, but they still don't have any money for food or any place to get clean clothes. And so some of our numbers have shifted a little, and we're seeing a lot of people we've not seen before, both because Long Beach is perceived as slightly safer on the COVID infection rates than LA City, and because Orange County, our neighboring county, has essentially shut down all services to the unhoused. And there have been some reports even of them driving folks over the line to LA County and Long Beach. Neighborliness.
Yeah, thank you. Thanks for sharing that.
Okay, and by the way, this particular report is something that those of you who signed up for the resources will be getting this. And some of you have asked who signed up for on an individual basis without the resources, if you can pay the difference and get it afterwards. Yes, you can. So that was one way of kind of looking at a summary of the neighborhoods around St. Luke's, Long Beach. A summary specifically from the standpoint of COVID vulnerabilities. But now we want to look at it from the standpoint of the needs of the community around you, what the population looks like, and what kinds of issues are present in the community. So this is called a Neighborhood Missional Intelligence Report. You'll be getting this if you signed up for the resources also. And the first page gives a snapshot of the neighborhood in terms of population, households, income, age, diversity, and lifestyles. And you see right off the bat that almost half of the neighborhoods in their ministry, their membership area is either Hispanic, Latino, or Black or African American. So there's a significant possibility of having needs there because they're at-risk populations. But then you look at the Neighborhood Missional Intelligence Report, and it gives you some stuff that's COVID related, but some stuff that's just the needs in the neighborhood, because obviously what you're doing when you're trying to do outreach is not just treat COVID or help people who have COVID or keep people from getting COVID, but you're also trying to meet the actual needs of the neighborhood, only one of which is related to COVID. So some of the things that stand out here, you look at these and you look for things that are above the national average. So here you have households in poverty. They have about 50% more than the national average of households in poverty. Employment is high everywhere, but they're about 50% higher in unemployment than the national average. So that's an issue. Housing units is also an issue in terms of renter occupied housing units, because even in normal times, having a high amount of renters means it's kind of a leading indicator of housing instability. So these people are housing vulnerable even in normal times. But when you're into COVID, that gets even worse because they're getting less, they have less income, some have been laid off, and they're now on the brink, a lot of them are on the brink of losing their lease. So some other things to look at are populations with disability, households with disability, and it's around the national average, but the national average is high. This means that 21%, almost a fifth of the population, have a disability. And then medical coverage. This is actually pretty low compared to the national average. This means
that no one is going to really want to be a liaison or
please. Yeah, please mute yourself. Thank you. This means that 32% of the population have no medical coverage. So in the times of COVID, and even in regular times, that's an issue. And then the crime index is an issue also. This 123 in the crime index means 23% above the national average. Let me let Nancy and Jane check in with us now about what this is showing.
Nancy first this time.
Thank you. I was just about to unmute myself. The renter occupant, the housing units, that is just something that is so true in our case. The numbers are correct. Again, one of the stories that I keep hearing over and over from a lot of our members and a lot of their neighbors as I deliver groceries is that fear that they're going to lose their apartment. They're going to lose their single. They haven't been able to pay rent. They have nothing saved. So this fear of where am I going to live? We're in a pandemic and there's nowhere for me to turn. They keep hearing in the news that there's going to be some help, some with rent, and no one is getting this help or the resources to access the help. So that's definitely something that jumps out at me as very true. And that's putting even more at risk those who are already vulnerable.
And part of what I'd add to that is the ways in which The CARES Act was ultimately passed. If you had undocumented people in your household, you were not eligible for CARES relief. And so we have substantial numbers, probably, I'd say close to the majority in our Spanish language congregation and immediate neighborhood who simply weren't eligible because of the restrictions put on access to CARES relief. And what we've seen with landlords is that even though there is in California and LA County an eviction moratorium, if you are undocumented, the threat of turning you into ICE makes it so the eviction moratorium really doesn't mean anything for you because the threat of deportation is way scarier than the threat of being unhoused. And then beyond that, like no one has created an answer to, and when the eviction moratorium is over. So we're all looking at this as this gigantic balloon payment that's going to come due whenever the state and this county pull off, and the city actually pull off their eviction moratorium. And so it really, it just is real anxiety about becoming unhoused, and families already doubling and tripling up so that they can pay rent on the one property, but living in unsafe conditions, or taking folks in when they have a Section 8, and then they're violating their Section 8 requirements, and so they may get evicted, not for non-payment of rent, but because they've got too many people in their unit. So housing is a massive threat for us. What we're also finding, and I'd say, unfortunately, I think the crime index number is a little low at this point, because everyone is stressed out financially, more people are working at home, we're seeing far higher levels of violence in our households and in our community. We go to our South District police community forums, and the amount of let's just say armed violence, the numbers of shootings, the numbers of murders in our community and in our immediate neighborhood have just gone up significantly in the last 8 months. And there are just a whole lot of stress factors feeding that.
And I would imagine that part of the reason it's lower than that it should be is because this only captures reported crime.
Right.
And with the high level of undocumented, you probably have a lot of unreported crime. So these are kind of 30,000 foot kind of summaries that give you kind of the high level overview. And when we work with a congregation, we look at this to get patterns and things where we need to dig deeper. And then we go into the maps that we have that can help people look neighborhood by neighborhood. Now, I met with Jane and Nancy yesterday afternoon, went through this with the Neighborhood Missional Intelligence Report and the COVID Impact Report, and then they selected several issues that they wanted to dig more deeply into. And so here is one. This is COVID vulnerability. Now the blue spots, the blue areas, I think these would be violet areas. So the dark violet is the highest vulnerability. These, if you're thinking about triage, these are the people you're going to have to pay the most attention to, both in the neighborhoods and in your households that live in those neighborhoods. So you want to know who these people are so that you can pay close attention to them. Now, at the other end of the scale, you have all this gray, which is very low vulnerability to COVID. And these are the people you don't not pay attention to them, but they don't have to be as high on your radar. And this is just an example here. We clicked on one of these neighborhoods, and its social vulnerability index is 0.89, which is pretty close to the highest you can get, and it's being driven most by minority language issues there. And the other one's probably households. So, and again, these are the households that we dropped onto the map. And this allows you to, as I was saying, this allows you to be able to triage not only the neighborhoods for attention, but it also allows you to triage your own congregation for attention. So another thing they wanted to look at was coronary heart disease. And so here they are again. Here is St. Luke's. Here you can see the dispersion of their households. And the darkest purple are high vulnerability to that, here and here and over here. And on the other end of the scale, you have the gray that's a little that's lower vulnerability. And in these pinkish areas, these pinkish purple areas are kind of moderate vulnerability. You still have to keep your eyes on them, but you need to pay the most attention to the dark purple areas. I'm going to do these maps go through them first, and then let Nancy and Jane comment on them. So the next they wanted to look at was ethnicity and the predominance of ethnicity. The grays are white, non-Hispanic. The teal color is Hispanic or Latino. The gold is predominantly Black, African-American. The purple is predominant Asian population. And this is the first place I've seen where it shows Native Americans. But this is probably, I looked this up, and there are actually 17 Native Americans working here. And that's why this says is predominantly Native American. So, so you see where they are in that, and so you can see that it actually turns out that the vast majority of the people in their area are Latino, followed by African American. And race and ethnicity versus police killings. Now, last month we did, or earlier this month, we did a workshop on systemic racism. And we found that all kinds of social ills kind of follow the areas where there was a red line, where there was redlining going on previously. And there was redlining going on in Long Beach. Redlining, is basically shunting minorities to the less favorable areas and shunting and advantaging those who are white by sending them to the most desirable areas, giving them the resources to be able to purchase homes. But note how these are clustered. Most of the time we see them high in the African American neighborhoods, but in this area, the police killings are clustered really heavily in the neighborhoods right around the church. This is a 10-year summary of police killings. And up here in another Hispanic Latino area. So that I just wanted to see if Nancy and Jane had anything to comment on that about, on those four maps. These are the ones that they asked for.
Can you go back to the one that shows the health issues, the coronary?
Mm-hmm. Yep.
I mean, that's something just like really interesting for us to see, again, with the stories that we're getting for the for those who cannot access any of the health services that are already having problems and issues. It makes us think about what are ways that we can, I don't know, provide some sort of help. Obviously not just the church, but how can we partner with others as we see these numbers? I did see in the comments the idea of offering English language classes. And I know that a lot of our partners are nonprofits and the community colleges do offer them. One of the realities is that even if you're offering English classes, a family has to make a decision of, do I attend the English class, which is obviously beneficial, or do I pick up another job to pay the rent that's already behind? So as we look at ways to help our members in our community, we need to keep those things in mind. How can we partner with others that are already offering these services? We don't just want to continue to multiply the same service over and over again. But I think this information, the health risk, is an important thing for us to look at as we move forward, and we think about how are we going to become this new church post-COVID.
Anything to add, Jane?
Yeah, and I also, when we look at the first chart you showed of the social indicators, part of what's really true for us as you look at where our people live is that we have sort of two competing high-risk groups, because in the gray area, we have a significant number of elderly white folks who either live in apartments or condos, or live in places that they bought before before Long Beach started being a trendy beach community that was sort of affordable in Southern California. And so they're hanging on to their places, but a lot of them are alone or two elders living together without access to outside support. And so even though they aren't financially at risk, they are by age demographic at risk. And then in the sort of purple area of high risk, we have a lot more of our Latino community, where folks are living with extreme poverty. And, I think just to say a little bit more on the English class thing, I think for those of us who are white, we often think, well, why don't they just learn English? They'd do so much better if they could learn English. And part of the reality of life is, if you are struggling, as Nancy said, to feed a family, to find little bits of work, however safe or unsafe they may be, you may know that you want your English to be better, but it is not going to rise to the top of the priority list. And so I think in the white community, and certainly this is true in our Long Beach community, there's a lot of blaming those who are monolingual Spanish speakers for not taking advantage of the English classes, because English classes do exist in the city. And I think we just need to hold that intention of the realities with whom those folks, the realities they face of when classes happen, how you access them. We actually do have more people taking English now that school is online. If they have internet access, it's becoming something a few more people have been able to access.
That's a good segue into one thing that I wanted to mention, is that these are just some of the maps that we could look at. And if you were to look at the houses without internet, those would pile up in the minority areas. If you looked at rent burden, that would pile up there. When you actually look at the rent burden chart, you see the heaviest rent burden here and a lot less here. And this is where the gentrification is going on and pushing up the values of rent all around them. So and the ones you'd want to look at would be different for each community, because every community is different, but they do tend to have those patterns. So
was asking about the hotspot, the internet access, and couldn't faith communities be hotspots?
Yes.
Certainly, yes, that is an option. A more long-term option is to actually work with internet providers to reduce the cost so that it's more accessible to everyone. And that's happening in some communities around the country.
Or work with local government, because some local governments have decided to put hotspots everywhere.
Right.
So again, when you begin to look at these things and see the patterns by neighborhood, it really speaks to you right away about what that means for your outreach. And you don't have to try to address everything you see, but you need to be aware of it, and you need to discern what part God wants you to address. Which brings us to planning itself. Now, we're not going to go through a full planning process here. Obviously, there's no time. But here are the steps in discernment and planning around COVID. First, determine which neighborhoods are at high risk, moderate risk, low risk for COVID, which congregants are at high risk, low risk, moderate risk, and low risk for COVID, just to look at it from that standpoint. But also, what are the greatest opportunities and challenges in the community? Because you don't want to focus entirely on COVID. You want to do the outreach that God is calling you to within the context of
And
COVID.
when you say COVID, you're not just talking about the virus itself, but you're actually talking about the impact of the virus on those vulnerabilities.
Right. So yeah. So you're trying to, you're looking at the impact and who is going to impact the highest in the community, who is going to impact the highest in your congregation. Do that kind of triage so that you can focus your attention where it's needed. What are the greatest opportunities and challenges in the community? And then we too often start with strategies or tweaking our current strategies, but you really have to think through what are the strategies that might best address the opportunities and challenges of each neighborhood. And you also have to think through what the promises and costs are of each strategy. I know a lot of people just think everything's going to be fine when they can get back in the building. But when you start thinking through that in terms of the costs of that, and there's a big promise in that, but what are the costs? If you're in the middle of COVID and you start doing worship services in the building, you probably can accommodate at most a quarter of your congregation and exclude the rest from the in-person. You have to make people sign up, which makes it exclusive. There's a whole list of things that I could mention that are trade-offs when you do these. And so you constantly have to think about the impact of every decision that you're making. And then this is kind of getting down to what part are you called to do? So what strengths, resources, and gifts can be brought to bear from our community, from our congregation, from other congregations and organizations. So we don't have to do everything, but we can collaborate. We can respond to it if we feel called to, but we can also feel called to be a catalyst for making things happen, or a collaboration between us in ministry, between our congregation and other congregations, and perhaps nonprofit organizations. And then last but not least, your first step. What is our first step? I mean, we can't know everything that we're going to need to do about this, but we can always figure out the first step. So what are some of I don't want to gloss over that these are difficult decisions. So what are some of the things that you can use for decision-making criteria? One I found helpful is comparing relationship significance to ease of putting online. And when it's, for example, when relationship significance is low and it's easier to put online, then that's what you put online. If it's hard to put it online and relationship significance is low, don't do it. If the relationship significance is high and it's harder to put online, find a safe way to do it in person. And we all know the ways, the CDC recommendations for that. And then here's the area where you're going to have to exercise the most discernment and individual judgment based on your context, is when relational significance is high and the ease of putting online is high. So that's going to be a judgment call that you'll have to make. So, and you can probably look through this list of things where it says congregational activities and outreach activities, and you can probably see how some of these things we normally do can do well online and which ones can't, which ones could need to be having a personal, a personal in-person contact. So like pastoral care, you know, you can't put pastoral care online very easily, and the relationship is high. So you have to find some way of doing that while being safe. On the other hand, sermons can be delivered just as well online as they can in person. And the same thing with outreach. Some of the typical things of outreach that we might do are things that don't go online easy, but like the community garden, but others might be. And an important thing with what you're doing, you remember I mentioned earlier that a lot of us, the trap that a lot of us fall into is that we are taking what we're doing in the building, what we're used to doing, and tweaking it a little bit, tweaking the what that we were doing before, tweaking it into a new what for now. But that seldom works. And the research is bearing that out, that those who are trying to just recreate online what they were doing in person, they're failing at it. What you really need to go is dig as deep as you can to not only your why, your purpose for doing it, but your why of whys. You know, what gets you and your congregation out of bed in the morning? What's your passion, your reason for being? And then rebuilding from that, thinking through the how and the what. A way to look at that is to think of it as a deep dive. So here's a pathway that kind of describes how that deep dive works. Basically, you dive deep into the why, and then you return to the surface with the what. So you start with, what were we doing then? How were we doing it? What was the content we were trying to deliver with that? Then why were we doing that then? And then we need to think, what is the why that God is calling you to address now? It may be the same why, it may be changed based upon how your congregation is changed. Then you go from that why to what kind of content that you have to deliver. And then from that, go to the what you're going to be doing now. Looking at that a different way is the revisioning worksheet. And we're going to be sending you a copy of this worksheet in PDF form, but you can think of it in terms of, tactics, strategy, and purpose, and the questions you have to ask. So tactics, what were you doing before? Strategy, how were you doing it before? Purpose, why did you do it before? And then purpose, going back out of the deep dive. Why does God want you to do something in this new context? Strategy being, how does this new context call you to do it now? And tactics, and finally tactics, then what does this new context call you to do now? And I want to end with one last thing. And that is the idea of what I call vision-guided experimentation. Because when you think about it, what COVID has done has basically kind of demolished what we were doing before, demolished all of our paradigms about what it means to be and do church, especially what it means about how to do church. So in effect, every one of our congregations has become a New Start congregation. And so you're having to reinvent things from scratch. And the way to do that is you have to have a clear vision, and then you have to experiment like crazy, quickly, often. Start small, build on that, adapt, apply, assess. If it's not working, toss it. If it's, so fail often, so you can get all those bad ideas out of the way, and then tweak it, and then adapt again. And just keep this cycle going until you find something that works. Because there are no experts right now. Experts need not apply. And to summarize then, what that says is there's a couple of sayings that kind of could hold us well in this, and that is, one is, the best things in life are messy, not free. And then the other one is what my congregation used to call the 9th Beatitude. Blessed are the flexible, for they shall not be bent out of shape. Or, as for short, Semper Gumby. So that's our presentation. Now we can open up to discussion and Q&A.
So if you have questions, you can either put them in the chat, or you can unmute yourself and jump in as long as no one else is speaking. So feel free.
Hi, this is John Borrego from Norman, Oklahoma. And one of the real challenges that we have is that we are in a university community, which is a good thing for an Episcopal church because we're just a few blocks away from the University of Oklahoma. But it also adds some interestingly unusual risk factors when you've got a whole bunch of kids in their, teens and 20s who believe they are immortal, and they don't want to stay out of bars, and there's who knows what's going on in the dorms and frat houses. So that's one of the things that we're trying to work through at this time.
It's hard working with people that think they're immortal.
Yeah, that's certainly challenging. So going back to the social vulnerability chart, Ken, they were asking, were the dots COVID cases or something else?
We do have maps that have COVID cases, but these are the members of the congregation of St. Luke's, Long Beach. So it's basically laying down a map of the areas and putting points on it that represent each individual household.
And then how do we open up people to accept that things have changed?
What was that?
How do we open up people to accept that things have changed?
Oh, I don't know. If this isn't enough of a 2x4 upside the head, I don't know what there is. But seriously, what we found is when dealing with both clergy and congregations, that the best way to help people understand that things have changed is not to tell them that things have changed and try to make them try a new way, but to start where they are. If they want to go back in the church, then ask, dig deeper into those questions and ask, how many of you want to come back into church? Of those of you, how many will come if we started next week? What are going to be the risks of doing that? And let them tell you the risks. They know them. If you don't play the side of trying to convince, but guide them through the decision-making process, people are much more likely to change. And the other thing is as you do this, as you begin to look at it in this kind of way, look for patterns, what you're essentially doing is creating a story. And data doesn't change people's minds at all. Story changes people's minds, because story is how we human beings create meaning. And so what we find that works best is to help people learn the story of their neighborhood, learn the story of their community, find their place in the community and the congregation's place in that story. And then from there, figure out what to do. It becomes a lot easier when people are engaged from the very beginning at the why you're doing what you're doing.
You know, Ken, I think too that it's part of it is the narrative and the language. And so using your story metaphor, when we look to the next chapter of the story, we don't go back to the chapter before. We go to what's ahead, what comes next. And there's a lot of mindset about getting back to the way things used to be, getting back to normal, as opposed to creating a new normal and understanding that, you know, we are moving forward from here. Things won't ever be the way they used to be, because like for many people who like online worship, there will be some who won't want to go back. They want to sit with their cup of coffee and in their pajamas and worship, or they're elderly and they can't come to worship in person and couldn't before. And now this whole new world of their congregation has been opened up to them. So framing change in the positive is always helpful. It's not a dirty word.
The other thing I'd say is, and this gets at the sort of how we engage change, because we, from March 16th on, approach change from the perspective of how do we take advantage of the new opportunities this moment presents us. And so for us in worship, it means that our liturgy is much richer in visual images than we can manage in our usual church. We've been able to identify seasons in a different way during ordinary times. So we did, in Spanish and English, 10 weeks of deconstructing racism. And most of the visual images we used in our worship during that time were billboards, just paintings that had gone up all over our city, made by the community. And we would just photograph them and insert them with prayers of the people, with just each petition having a mural from our city. And I think that people, we've also ironically been able to involve a whole lot more people in worship, because no one's going anywhere. And, you know, so if you want to have 10 different people leading things, mostly once you teach them how to mute and unmute, you can just have a real community experience of worship. We've been able to use videos, particularly the videos of Work of the People, in terms of invitations to communion, because they're you know, creation is the first sacrament. How isn't that an invitation to communion? Using Teilhard de Chardin as our prayer for spiritual communion, in terms of his Mass in the world. So it's really looking for how are the resources that allow us to make this a richer experience, not how do we do online what we used to do in person. And now, of course, we've created a monster for ourselves, because to return to church, our physical space doesn't allow the visual images. like nice stained glass windows, but like, so we're now like, uh-oh, how do we do this? And that's a new arena of challenge and conversation in our community.
And fun too.
Yeah.
Exciting.
Exciting. Yeah. So when we talk about how do we, what physical worship might look like. Now in LA County, we currently cannot have more than one household gathering. It's an interesting concept. But we're talking about, well, so do we add a Saturday afternoon liturgy that is bilingual and leave Sunday morning on Zoom and Facebook Live as they are? So what do we put into our rotation that maybe needs to be maintained long term?
Okay.
Jane, I appreciate that positive affirmation at the end about the way change can actually be a real encouragement to us to embrace new things. And I want to thank each of you for coming today, for sharing this time with us, and especially thank Jane and Nancy for co-hosting with us. And you will get the take-homes that we talked about, as well as a link to the recording, and you can see the other resources here. So Ken or Mary, do you have anything to follow up?
Nope, I just mentioned that those of you who have inquired about, if you signed up without the resources and you decide you want them now, just send us an email to info@St. Nick's, excuse me, that's my old congregation, info@faithx.net, and say that you want the materials. We'll produce them for you and invoice you for it.
Yeah.
And I thank you too. I thank all of you too for coming.
Thank you all.
Yeah, thanks to all of you for coming. Also, watch for information on our upcoming events. Our next one will be in January, so we've got a little time, but we'll be sending you information about that.